Hello, my name is Gabriel Quesada from El Salvador. We're going to talk today about the bilateral small aperture IOL after cataract surgery. These are my financial disclosures. We're going to compare the bilateral implantation of the masked small aperture IOL to the unilateral implantation and monofocal IOL in the dominant eye. This is a retrospective consecutive case series of 40 patients bilaterally implanted with a masked small aperture IOL versus another 40 patients that had just unilateral implantation of the masked IOL and a monofocal IOL on the other eye. We have two different groups, 40 patients with a small aperture in both eyes and 40 patients with small aperture in the non-dominant eye and monofocal IOL in the dominant eye. At 6 months post-op, we measured subjective patient satisfaction, uncorrected visual acuity, and adverse events. And as a results, in group number 1 that have bilateral implantation of the masked IOL, they have uncorrected distance vision of 20/23 at distance, 20/24 intermediate, and 20/30 near. And in the second group, they have 20/23 distance vision, intermediate 20/24, and near 20/30 on the eye that had the masked IOL. But on the other eye, their intermediate and near vision were 20/50 and 20/70. As you can see here, the patients that have bilateral small aperture IOL had a better near and intermediate vision than the patients that had it in just one eye. 95% of the patients of group 1 achieved binocular uncorrected visual acuity of 20/20 at distance, intermediate, and near. 96% of patients with bilateral small aperture IOL would have the procedure again. This is just to show you. In group 1, patients with bilateral small aperture IOL, and in group 2, a monofocal IOL in the dominant eye and the small aperture IOL in the non-dominant eye. Patients with bilaterally implanted masked small aperture IOL have reported minimal adverse postoperative symptoms that were similar to those patients with a monocularly implanted masked small aperture IOL. There were no halos, no glare. And as a conclusion, we would say that patients with bilaterally implanted masked small aperture IOLs demonstrated excellent monocular and binocular unaided vision with minimal adverse subjective symptoms, and the postoperative symptoms of bilaterally implanted patients were similar to patients with monocular implantation of the masked IOLs. Thank you very much.